You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. All right, my first guest loves to say, listen, listen. Y'all better listen in her Charleston, South Carolina accent. I'm talking about Dr. Ebony Hilton. She's been a frequent guest on the show. Go ahead and pull up. Listen. Listen.
Well, they should have listened. If they did listen, we wouldn't be in this mess that we're in right now. So there's that.
So y'all, Dr. Ebony Hilton, she has been, of course, from University of Virginia, also with Good Stock Consulting out of South Carolina. She has been constantly upset with these folks when it comes to COVID, not want to put their damn mask on, folk getting upset about the vaccine. Ebony got one of them space age masks that she wears when she's in the hospital, wear it for 13, 14, 15 hours a day. She don't even take it off to eat, y'all. She ain't taking it off. Nope. And so you got the Delta variant that, of course, is happening all across the country. Now you have the Lambda variant is causing many conversations about vaccines and mask mandates. Here are the COVID numbers as of today. In the U.S., 35,019,526 reported cases of COVID-19 and 624,998 reported deaths. Now, we are seeing increases happening in a variety of states. Now, the White House, they've also reached out to Fox News regarding their controversial COVID coverage, often spewed by Tucker Carlson, Sean Hannity, Laura Ingraham, and others. This is former Fox White House correspondent Carl Cameron talking about the spread of misinformation by folks like Tucker Carlson.
It's about ratings.
Just money.
And ratings ultimately become revenue. And that's the name of the game. Whoever gets the most clicks on social media makes the most money, gets the most fame, gets the most attention. And that type of activity is not journalism. It's not news. It's gaslighting. It's propaganda. I mean, just last week, new infections went up 70%. And according to the CDC, the NIH, which oversees the CDC, it is absolutely 99.5% of those infections are people who haven't gotten vaccinated. I mean, come on. Anybody who disputes that sort of stuff is putting people's lives at risk and potentially killing them.
Then, of course, last night you had all of a sudden Sean Hannity with a different tone. I'm just curious, are they going to get sued or something? Because normally, you know, when they decide to change their tone, things are result of a lawsuit. Y'all, here is the blabbermouth himself last night. Listen.
Just like we've been saying, please take COVID seriously. I can't say it enough. Enough people have died. We don't need any more deaths. Research like crazy. Talk to your doctor, your doctors, medical professionals you trust based on your unique medical history, your current medical condition, and you and your doctor make a very important decision for your own safety. Take it seriously. You also have a right to medical privacy. Doctor-patient confidentiality is also important, and it absolutely makes sense for many Americans to get vaccinated. I believe in science. I believe in the science of vaccination. Just like we've been saying.
Now, it's a whole bunch of folks on Fox News, y'all, they got their vaccines. Remember when they were complaining about the vaccine passports? You do know at Fox News they have to require that to even come into their building. But just so you understand the game that's Carl Cameron, y'all, he spent years at Fox News is playing. Check this out. I saw this where I was coming in and, you just heard Sean Hannity there on Fox News. This is Media Matters. Sean Hannity tells his radio caller he was correct to ignore his doctor and refuse the COVID vaccine. See, y'all need to understand the games being played. See, this is why we're dealing with the Delta variant and cases are increasing in Texas and California, because all these idiots who keep listening to people like Sean Hannity and Tucker Carlson. When you heard President Joe Biden say Facebook is killing people because they allow misinformation, their algorithm, folks, drives revenue. And when you have these conservative people on the right, like Ben Shapiro and others, Dan Bongino with the top numbers on Facebook, they're spreading misinformation. That, Ebony, is the problem. They literally are listening to these idiots as if they're giving them great information.
Right, and it's ridiculous considering the fact that you don't have to. I don't know the saying. You don't have to see a duck to know it's a duck. Like if you can hear it quack. We've been now in this pandemic for a year and a half. We shouldn't have to tell people that water is wet and that COVID is dangerous. But yet here we are, and what we're seeing across the nation. We have an increase in 198% in our COVID cases over the last 2 weeks. And if you think about the last 2 weeks, that means January the 4th, where everyone was partying. That's where we're seeing these numbers right now. So 198% increase in new cases, 45% in hospitalizations, 45% in death, even though our testing is down 13%. So imagine that. We're not testing as much as we were 2 weeks ago, and yet our counts are going up, which is a bad sign. And if you're looking at it across the board, Mississippi has had an increase in over 308%. If we're looking at Arkansas, we're talking about 120%. Alabama, you can go literally across the board. You're looking at 300% increase in your new cases. And I hate to say it for Mississippi, with this 300% increase, you don't have the hospital density that they do in New York City, that they do in California. You don't have the infrastructure in place. So all those persons that are getting infected, the likelihood of you dying increases because the resources there to keep you alive are simply not there. So
and what happened was, Ebony, we had these people who we got to open up, and they were putting pressure. There was pressure on the Biden administration to do so. They lifted the mask mandate, and folk just lost their damn mind. I mean, the moment the mask mandate was lifted, folk just lost their mind. Now you got Los Angeles reimposing the mask mandate. Now they got people who are mad at them because they're saying, even if you've taken the vaccine, wear your mask. And we had a scientist from North Carolina A&T on who kept trying to explain to people that that the COVID vaccine is not 100% proof. That just because you get the vaccine does not mean you can't get COVID again. It drastically reduces the possibility. And if you do get it, it's not going to be as fatal as it was as it was last year. But we're seeing increasing number of people who have gotten it. Coco Gauff pulled out of the Olympics because she got COVID. Rich Eisen with the NFL Network vaccinated, he got it. Bill Maher, he got it. There was another media person the other day where, and they, again, all took the vaccine, but they still got it.
Right. I mean, the closest thing I can give to people is birth control pills, right? Women, we know we can take birth control pills, but if you go and you're not protected or you're not using other methods of trying to have contraception, you can still get pregnant. Same thing with COVID-19. The vaccine is supposed to allow your immune system to be ready on day 0 if you get in contact with someone with COVID. It does not prevent someone from coming into your presence, coughing in your face, and actually transmitting the virus to you. It's not the analogy I use is like a raincoat. I can have a raincoat on and keep me dry for the most part, but if I jump into a pool of water, I'm going to get wet. Same thing with this vaccine. You cannot rely on it to prevent you from getting infected. It is supposed to be a booster for your immune system to be able to respond. And a thing I think I said on the very first time I was on your show, we use death too much in America as a sign of how this pandemic is going. There are other consequences of COVID other than just death. The vaccine does a fantastic job of keeping you alive if you get infected with COVID, and that's fantastic. But what we do know is that long COVID does this, and long COVID is where the inflammatory process of this virus literally causes your organs to work differently, your brain, your kidneys, your lungs. And so there's studies out of Stanford, for instance, where they looked at people who didn't present with brain like symptoms of loss of taste and smell. They didn't have that. But when they did autopsies on these people after they died from COVID, their brains resembled those of persons with Alzheimer's and Parkinson's disease. We don't know what this virus is doing as far as the impact it has on your body structurally. And there was a report by Fair Health of over 2 million people. And what they found was that 23% of those 2 million people complained of symptoms of COVID-19 for at least greater than 30 days. And that's what they were using as a marker for long COVID. And the interesting thing is that 19% of people who said, I didn't have any signs and symptoms of COVID. I didn't have a cough. I didn't have a fever. I literally just went and got tested and I came up positive for COVID. Well, 19% of those persons like that said that within those 30 days, something about their body was different. Either they complained of GI upset, they complained of what we call COVID brain fog, or inability to concentrate. They had painful experiences. They had differences in their lab work. And those are people who didn't even have any signs and symptoms that they were infected in the first place. So to play around with COVID when we don't know the long-term impact it can have on your body is a dangerous game to play.
You know, and then, I've got fools on YouTube going, oh, this is a con game. This is a joke. The vaccine is a joke. And I'm sorry, it is not a get out of jail free card where, oh, I can now just go out and wild and out and I can just walk around. And part of this thing was, this is where the information came in, Ebony, and where it was problematic because then it was like, oh, well, no, sure, if you've got vaccinated, you can be in groups now and you can be in groups of, up to 10 and 20 and everything is fine. It was kind of like, yeah, but you don't know if they ass got it.
Right. And we were saying that with the CDC's lifting of the mask mandate, we had to realize it was based on information that was coming out of Israel. And Israel did a fantastic job at vaccinating their country. They literally had 60% of all their adults vaccinated by April the 3rd or 4th, I think it was. But they still didn't lift their last mask mandate until April the 18th to allow for even more persons to be vaccinated. Now, we in the United States of America, we still have not gotten to 60% of our population fully vaccinated, and we know that. And so for us to try to use Israel as a surrogate for what we should do here was premature, in my opinion, for one. For two, we know that we have to think about COVID on the global scale of things and then also locally. So to tell the entire nation, United States of America, hey, you can go about your lives and take off your mask and wander about, when we're having outbreaks in Missouri where people are literally have to transport their patients out of state because they don't have any hospital beds for them. We have outbreaks in Mississippi, Florida. Literally 1 in every 5 new cases of COVID is coming out of Florida. Stay away from Florida. When we have those types of situations, we can't make these blanketed statements and say, go out and be free when it's not safe. And vaccines, for those persons saying that vaccines don't work, what I'm telling you, in my ICU right now, I have a person half my age, literally. If they don't get a lung transplant, they will die. That's the truth of what happens. It's not old people. It's not the sick people. It is people that look just like you and me that are struggling to breathe at this point. And it doesn't have to be that way. The vaccine does a fantastic job of preventing you from getting to that severe form of COVID-19.
Look, one of my lawyers was misdiagnosed. Absolutely believes that she has COVID. Doctor said, you have COVID lungs. 3 months ago, she said, I need to transfer your work to someone else because I am still dealing with COVID 1 year later. Mm-hmm. And I texted her the other day just to see how she was doing. And she's getting better, but this is a year later. And these people are playing games. You tweeted this, a friend who got vaccinated. I think she's a doctor, if I'm correct, and got COVID. There are so many other examples. I saw a tweet the other day where a young lady out of Houston, she's a pharmacist, and her dumbass boyfriend refused to take the vaccine. Now his ass is in the hospital, in the ICU, fighting for his life because he was like, oh yeah, a vaccine is stupid. We see these other stories where people were big time anti-vaxxers, and now they're literally fighting for their lives, and they're posting these photos of them in their hospital beds. And I don't understand how nuts folks are on this. I don't get it. I don't get it.
I don't get it either.
I'm not trying to play games. I'm not trying to be sick. And again, bitching about a mask. Like, first of all, Ebony, here's what's so crazy.
Yeah.
It's not that many times I'm actually around a lot of people. So when I walk into a convenience store, mask. Now, when I'm walking out and ain't nobody on my left and ain't nobody on my right or in front of me, behind me, hell, I take it off.
Right.
I'm trying to figure out why is it so hard.
It's hard because people want to make it hard. People will complain about the wetness of water if you let them. But what I do know is that those same persons who are complaining about a mask, when they come into the hospital, they are begging for a mask that has some oxygen because they can't breathe. And I think what we have to realize is the burden that it placed on medical professionals. You mentioned the retweet I did of a physician who is now infected because trying to take care of persons who have COVID in the hospital. That's one of my greatest fears. I mean, I go to work and I will go to work and take care of patients because that's what we're supposed to do. But I don't want to die. And so for persons to be as selfish as they are to say, I just don't want this, right? If you have curiosities and you have concerns about how the vaccine works, for sure, let's talk that through. But if it's just I just don't feel like doing that, then if COVID touches your throat and you cannot breathe anymore, think about if you're going to keep that same energy. Because if you're not going to keep that same energy and you're going to want someone to help you, then help me help you. Go get vaccinated. You can text your zip code to GetVax, which is GETVAX, and it'll have all the information of exactly where within your locality you can go and get vaccinated. If you have questions, find me on Twitter. Write me, and I'll try to answer as many of your questions as possible. But what we know is that right now, the persons that are dying in the hospital aren't the very old, because we've done a great job of vaccinating our elderly population. Over 70-80% of those elderly people are vaccinated. It's young people, and they're leaving behind their kids. They're leaving behind orphans at this point. You don't have to do that. You literally can get a vaccination, save your life, and hopefully, if we are to get infected, if I do get infected, hopefully the vaccine will prevent me from getting long COVID and a permanent disability related to this virus. So, yeah.
Look, I got this fool here. Y'all are just mad because we won't run off the cliff with the rest of the sheep. Okay, Silver Harmonics, well, when you die of COVID, let us know. Let your family. No. See, sometimes you got to go ahead. So, Silver Harmonics, if any of your family members are watching, if you die of COVID, let us know, because you were stupid with the comments you made on YouTube. Then I got this first person, Blessing Season. So you trust the government. What about the Tuskegee experiment? Okay, let me say this
Can I talk on that for a second? Can I talk on the Tuskegee?
Go ahead. Because I was going to go ahead and handle it, but go right ahead.
Because Tuskegee is brought up over and over again, but if people truly know the history of what Tuskegee actually was, Tuskegee experiment was carried out from 1932 to 1972, just 10 years before I was born. It was actually ended. And this Tuskegee experiment was actually the U.S. Public Health Service calling out to the Black community saying, we want people with quote unquote bad blood to come in, and we're going to give you treatment for bad blood. But actually what they were looking for was people with syphilis. And the thing with Tuskegee was that they did not give them treatment. That was the problem with Tuskegee. They
Hold on. Let's slow that down. They were not injected with anything.
No.
What they did was monitor them. They didn't give them any. They didn't provide any medical care. There was no injection of Black people to the Tuskegee experiment. Go ahead.
Right. And that's the problem. We knew that the cure for syphilis in 1940 was penicillin. So for 30 years, they allowed this experiment to happen, knowing they had a medicine that could cure these people. And so with COVID, when we've been watching for this last year and a half, Black and brown people dying at higher rates, if the United States government said, we have this vaccine that could save your life, and they said, we're not going to give it to you, that would be Tuskegee Part 2. But what we have now, this whole idea of I don't want the vaccine because they may be trying to do something. Do you think I would go and tell my grandmother to do this? Do you think you would see that the most powerful people in our country were the very first ones running up on stage to try to get vaccinated because they realize this is the only thing that can keep them alive to see 2022. We've already lost 630,000 Americans at least. And that number is grossly underestimated because we weren't testing a lot of people early on in the pandemic because we didn't have tests. So when we're looking at that, it's again, whenever you're trying to come up with an argument, and I welcome healthy discussions, but make sure it's based in facts. And if you're going to bring up Tuskegee, just realize that Tuskegee was the holding back of medicine. It wasn't the giving of medicine. They knew we were sick, and they said, I'm not going to treat you because I want to see what syphilis does to the brain, to the lungs. What does it do to someone if we don't give you medical care? Well, you don't have to have that anymore in America. You can get treatment, and that starts, especially in this pandemic, with, again, texting GetVax, GETVAX, your zip code, and you can find out where to get vaccinated.
All right then, Dr. Ebony Hilton, and I see your nice little cute candles over there over your left shoulder.
I got to zen out. This has been a stressful week. I'm tired.
Yeah, no, you trying to get your little 10 for 10 on Room Raider on Twitter. You ain't fooling me.
It's a candle. From Rewind, and actually that's a great company.
I mean, you got the books, you got the candles, you got your 18 degrees on the wall.
This is not office.
Only thing missing is your little.
You give everybody else this kind of grief.
Yes.
I ain't seen it.
I give you extra grief.
I'm gonna give you extra grief.
I ain't seen it. Okay, Charleston.
I haven't seen it, but I'm gonna take a peek.
All right, we'll chat later.
All right, I'll see y'all.
All right,
Bye,
take care. All right, y'all.
Folks, back to our Roland Martin Unfiltered video in just one moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.